Case study, Diagnosing Achalasia through the Beak sign, in a 55-year-old patient, a guide to esophageal motor disorders. Introduction. Achalasia is a rare esophageal disorder affecting around 1 in 100,000 individuals annually. This case study explores the diagnosis of achalasia in a 55-year-old patient, specifically highlighting the Beak sign on a barium swallow. Patient presentation. A 55-year-old patient presented with chronic dysphagia, regurgitation, and weight loss over 6 months. Evaluation and findings. 1. Physical examination was normal. 2. Barium swallow revealed the classic Beak sign, a tapering of the distal esophagus. 3. Esophageal manometry confirmed achalasia, with specific findings consistent with type 2 achalasia, most common subtype, accounting for approximately 65% of cases. Treatment. 1. Pneumatic dilation was performed, leading to significant symptom improvement. Exam-focused facts. 1. Achalasia. Motor disorder, incidence of 1 in 100,000 per year. 2. Beak sign. Pneumatic feature on barium swallow, seen in over 90% of cases. 3. Symptoms. Dysphagia, 90% of patients, regurgitation, 85%, chest pain, weight loss. 4. Diagnosis. Barium swallow and esophageal manometry are definitive tests. 5. Treatment options. Halar myotomy, 90% success, pneumatic dilation, 70–80% success. 6. Etiology, mainly idiopathic, Chagas disease can cause secondary achalasia. 7. Differential diagnosis, structural and functional esophageal disorders. 8. Prognosis, symptomatic relief achievable, but ongoing management needed. 9. Bird's beak appearance, specific to achalasia, a critical radiological finding. Conclusion. Recognizing the Beak sign is key to diagnosing achalasia and providing targeted treatment. The inclusion of relevant statistics enhances the understanding of the disorder's prevalence, diagnostic features, and treatment outcomes. Where to find more info? Refer to gastroenterology textbooks, clinical guidelines, and research articles for detailed insights.